Yes, for today's case discussion, I selected an 11 years old female patient who presented with worsening anxiety, mood symptoms, and school refusal over the past 3 months. Her mother and teacher both reported significant functional decline, including crying episodes, difficulty concentrating, and panic-like symptoms before school. The patient described persistent sadness, excessive worry about academic performance, and fear of making mistakes, and somatic complaints such as stomach aches. She also endorsed sleep disturbance and fatigue. On mental status exam, she appeared clean, appropriate dressed, with constructed affect and soft speech. She was cooperative but fringety and avoided eye contact. Her thought process was linear, and she denied suicidal intention, homicidal intention, or psychotic symptom. Cognition was intact, though attention was mildly impaired. Based on the clinical presentation, I developed a differential diagnosis that included generalized anxiety disorder, major depression disorder, and adjustment disorder with anxiety, ADHD inattentive type, and social anxiety disorder. So generalized anxiety disorder emerged as strong diagnosis, and according to SM50R criteria, general anxiety disorder require excessive worry, requiring more days than not for at least 6 months. Difficulty controlling the worry and associated symptoms such as restlessness, fatigue. This patient demonstrated persistent worry, sleep disturbance, somatic compliance, impaired concentration, and significant functional impairment across home and school setting. Additionally, her family history of anxiety increases diagnostic likelihood. So for major depression disorder was considered due to her sadness, irritability, sleep disturbance, and fatigue. However, her symptoms were more closely tied to worry and anticipatory anxiety rather than pervasive depressive episodes, and so an adjustment disorder was also considered because symptoms begin after a school change, but the severity and breadth of symptoms decided what is typical for an adjustment response. So ADHD inattentive type was ruled out because concentration difficulties appear secondary to anxiety rather than present across multiple settings. So social anxiety disorder was also ruled out because anxiety is generalized and not limited to social interaction. In my summary, the patient meet full DSM-5TR criteria for generalized anxiety disorder with additional rule out including major depression disorder, and adjustment disorder, ADHD inattentive type, and social anxiety disorder. So this diagnostic formulation is supported by symptom pattern, functional impairment, correlateral information, and evidence-based criteria. Thank you.